Today we are going to talk about applications of deep learning in the healthcare industry that mainly focuses on disease detection and diagnosis. And since all of you are working on variety of applications till now, in this course itself, you might have done various case studies on different types of deep learning applications. So healthcare is one of the most important concern these days that researchers need to address, especially to ensure a safe lifestyle for the populations around us. And in the healthcare industry, this AI is showing plenty of valuable updates by utilizing some latest models designed by researchers across the world. So I'll just give you a little bit of theoretical background on the topic first. We'll try to understand how this deep learning is helping in the healthcare industry and what are the recent updates in this area and what kind of applications we can think of while combining deep learning in the healthcare industry. That is definitely in terms of business also it is having a bigger scope, and in terms of social service and research also it is having a bigger scope. So let us have first the overview of deep learning. Although I understand that you might have gone through these things, the basics of deep learning, etc., in the previous sessions, so I'll not go very in depth with deep learning basics. Just one or two slides I'll include here to just brush up your concepts, and then we'll move to the core concept. So deep learning is widely considered as a subset of machine learning in which we take help from in-depth neural networks to process data as well as to make decisions. The main concept in comparison to machine learning here is that deep learning models are capable enough to handle a raw data set as well to make precise decisions. However, in case of machine learning, we are more focused on providing data science based principles in the pre-processing stage to make data set ready for a machine learning model. So that entire pre-processing pipeline we can avoid in case of deep learning models. Majority of models are going to accept your raw data as it is, and you can proceed with that in order to lead the implementations further for real-time case studies. The idea with deep learning is to extract patterns and features without requiring any manual intervention, because there are hundreds or thousands of layers within a deep learning model that can handle all the patterns of data automatically. We can just assign it the target task that we want to achieve, and rest all the model will do itself. The key components that we can consider in case of a deep learning model include input layer, output layer, and hidden layer. This is generally like a simple neural network itself. But in actual, there is a large number of hidden layers that makes difference in comparison to a basic neural network. In basic neural networks, you might have gone through like there are 2, 3, or limited number of layers within the network. But with deep learning, we have hundreds or thousands of layers depending upon how big data set we want to handle or what kind of objectives we want to achieve with that particular application. And of course, these neural networks require weights and biases for the learning process. And this makes your entire flow for the decision making, because the weights and biases are adjusted on different layers to handle input data sequences, and that brings you the output based on the target objectives of your modeling. The neural networks that work behind deep learning model include the perceptron, one of the most important thing that we have. This is the basic unit of any neural network that helps us to mimic the behavior of neuron that we otherwise consider in terms of human capabilities. So we just try to mimic that behavior of human brain into a neural network model with this perceptron algorithm initially. There are plenty of activation functions also that can help you to transform data as well as to introduce non-linearity into the model. And then the backpropagation networks. This is another popularly used neural network in the domain that helps you to make predictions by reducing errors by utilizing some advanced modeling approaches in comparison to perceptron algorithm. When we talk about deep learning networks, there are plenty of advanced versions of neural networks that we can consider that include convolution neural network, recurrent neural network, and generative adversarial neural networks as well. So CNN, RNN, and GANs, these are some of the most popular names that you will hear these days. Out of these, CNNs are widely used for image analysis. RNNs are generally preferred for sequential data such as genetic sequences or ECG, etc. However, GAN models on the other side are widely recommended for augmenting training data sets when we have like some synthetic data to be generated. In those applications, we prefer generative adversarial networks widely. In order to use deep learning in the healthcare industry, there are so many considerations that we keep in our mind. There are few big benefits as well to incorporate this technology into the healthcare industry. That includes the very first and most important concept that deep learning models can handle a massive amount of data. Even complex data sets it can handle easily, especially the genetic data as well as the medical images, MRI scans, CT scans, etc. All those details these deep learning models can handle very precisely. Similarly, these models are capable enough to learn from the hidden patterns available in big data so that most accurate predictions can be made in the long run. And they are going to provide real-time insights without requiring any human intervention, and this could lead to early diagnosis. Over the years, we have experienced that the biggest challenge in the healthcare industry is timely diagnosis, because most of the time when doctors are conducting investigation on the patient symptoms, it generally takes several weeks or several months sometime. And in that duration, sometimes diseases switch from one stage to other stage, and it becomes more critical to diagnose them or to treat them at later stages. So, in order to avoid such critical instances, it is better to have some real time decision making possibility with the help of AI algorithms. And deep learning is one of the most widely followed subdomain for that because it assists in easy pattern analysis from patient data, as well as these models assure scalability in terms of large data processing, like even thousands of scans they can process simultaneously. These networks can be deployed on some large scale networks, and they can help you to process patient information every second to provide quick decisions. And it also reduces human error in diagnosis that is generally a common thing across medical industry. So these all things can be avoided with the help of a good or a widely trained network. Then it also assures accessibility in the healthcare industry because such trained models can be even helpful in treating patients at remote areas where some high-end machineries are possibly not available for maybe test analysis or for symptom analysis at initial stages. But maybe by inserting reports or the information about patient symptoms into a AI model based user interface, maybe we can get quick diagnosis reports from there itself. So these are some quick ideas that we need to keep in mind, and it shows the potential of deep learning in the healthcare industry. However, there are plenty of challenges as well present in traditional healthcare industry that influence us further to make use of latest technologies to deal with the area. For instance, biggest challenge, as we discussed, is manual diagnosis and errors, because diagnostic accuracy is very important in medical domain. And when it depends on human expertise, then there are chances of errors also. Sometimes misdiagnosis rates lead to more complicated cases. And it is said that the misdiagnosis rates for complex disease generally exceeds by 10%. So you can just observe how difficult it could be for the patients. Like sometime maybe a healthy person could be diagnosed with certain disease, or sometime a person with disease could be diagnosed as a healthy person and he will not receive the treatment on time. So this leads to some challenging scenarios in the healthcare industry. Similarly, these processes are very time consuming with the traditional approaches. They require you to go through multiple stages of tests or consultations, and there are several delays involved in the review process among doctors and patients, and several consultants involved in big hospitals. So with this, the critical conditions get difficult to diagnose on time. And other than this, the access and resource gap, as I told you, that in some rural and remote areas there are limited medical infrastructure, limited facilities, and there is a shortage of trained medical professionals also for specific disease cases. So in these instances, maybe the modern healthcare solutions powered with deep learning algorithms could be a better solution for doctors as well as for the caregivers and the patients. The AI and deep learning techniques allow us to step ahead of the challenges that we are facing with the traditional methodologies, because in this case we are able to get data driven insights, since healthcare system or healthcare industry keeps on generating huge amount of data every day. If you just take a common scenario, like if you visit a hospital someday, you will see like there is a huge population, there's a huge crowd that is suffering from some kind of diseases, because you will find huge patient count in every hospital. So that shows that how much critical this concern can be. Every day we are generating huge amount of data, because the patients are being diagnosed with different kind of diseases. We are taking their test, we are using some imaging techniques of them, we are using some wearables also to track fitness levels of the patients. So all these devices are generating vast amount of data every day, and the deep learning models can be utilized to analyze this particular data gathered from different patient conditions to uncover different patterns, some anomaly conditions, or some specific insights that are relevant to their health conditions. Similarly, these deep learning models can enhance the diagnostic accuracy because they show highest performance when trained on good quality data set. There are plenty of hospitals in different countries that are already using AI experts for diagnosis purpose. Like they are using it specifically for early cancer detection as well as retinal disease diagnosis, because these are some of the most complicated scenarios we have in the trend these days, and some AI models can assist better in this area. Then we have scalability and speed as some of the major outcomes of utilizing deep learning models here, because as I told you that these can help you to process thousands of uh, patient details or patient cases simultaneously to make quick decisions in the output. Moving further, with the global benefits of AI in the healthcare, it ensures improved access. At the same time, the cost efficiency in terms of reduced diagnostics and treatment cost, because we are utilizing automation principles in between by combining IoT and AI together. Similarly, it leads to better outcomes with higher survival rates that ensures better quality of life for patients and easy decision making for the doctors as well. It can foster innovation as well with collaborative research by utilizing AI based accelerators for drug discovery. And it is also being widely used for vaccine development, which is a very potential area to be addressed in the healthcare industry, since several new type of diseases are entering into our uh, populations these days. Several new pandemics are being introduced time after time. Biowar is one of the biggest threat. So in these all conditions, AI could be a great help to discover relevant drugs as well as to develop vaccines on time so that we can treat patients in critical instances. Let us talk about deep learning applications in the healthcare sector now. We have just gone the overview of this, and now let us talk about how this subdomain of AI can work in different areas within healthcare industry. Starting with the first, we have medical imaging, because this is one of the most important part of healthcare industry, because this puts the foundation for the diagnosis process. In medical imaging, we talk about the techniques and processes that are utilized for visual representation of the interior of the body for different types of clinical analysis as well as medical interventions. It could include maybe X-rays, maybe MRIs. We have CT scans for this. Ultrasound is there, and nuclear medicine is also there. So all of you might have heard about these things. In day-to-day life, we keep on hearing about these kind of diagnosis procedures, because these medical imaging techniques help us to ensure a non-invasive diagnosis. So this is on more popular type of treatment, or more popular type of technique used for the diagnosis these days. And it is easy to do for a majority of disease cases also, because for all type of patients, for all age groups, we can pursue with this medical imaging. So this is gaining popularity across the world these days, and it offers like a early detection solution, monitoring solution, as well as assist in treatment planning. You might have seen that in many hospitals, whenever you go with like any kind of symptom related to maybe bones or maybe your muscular activity, sometimes some imaging techniques they try to follow to understand what is happening inside your body, and accordingly they suggest treatment. So in this area, if we can train some deep learning models to understand the information carried by those modalities, maybe in the form of X-rays or MRIs, etc., then maybe we can make some better decisions in the long run. So the applications of AI in this area can be like to identify anomalies present in MRI, CT scan, or X-rays, etc., so that we can provide early diagnosis for the conditions. That could be maybe cancer or fractures, etc. Similarly, AI can even help you with precise segmentation of tissues or organs, because if certain part is damaged, the medical imaging is a most proven way to identify that particular segment, so that some surgical planning or treatment procedure can be decided based on that. Then further, the detailed radiology reports can be also generated based on this. It could help you to reduce the workload for the radiologist. Some of the most common examples based on the case studies that are conducted by different researchers till then, there are some research papers that recommend CNNs for lung cancer detection with a sensitivity up to 95%. And some recent researchers have even grown above this by utilizing some fine-tuned models. It can also be used with the mammograms for detection of breast cancer. So these are some widely used techniques in the medical imaging domain. Then in the pathology sector also, this is another widely used diagnosis technique in the healthcare industry, where we try to automate the cellular analysis. So in this case, the pathology, the technique or the procedure that we follow, it is basically involving some microscopic examinations and that is done with the help of different kind of machineries. And the main idea is to examine tissues, cells, or different bodily fluids, so that we can understand if there are some unwanted conditions inside body or not. So for this case, the automation of cellular analysis that we do with pathology, we can use AI integration in that. It can help us to automate the identification as well as classification of the cells, so that the manual effort can be reduced. Of course, it can enhance the accuracy also, because instead of analyzing every anomaly manually, we are doing it with the help of some well trained models that can help us to minimize the diagnostic errors in the long run. And it can offer you the faster turnaround time as well. It accelerates the diagnosis procedure while improving the decision making for the clinical trials further. The major benefits of utilizing deep learning in pathology sector is to automate cell counting as well as to ensure abnormality detection on time. And it can also reduce the workload on the pathologist as well, because these deep learning models essentially help both patients, caretakers, as well as doctors in the same domain. Similarly, the widely used applications of deep learning here we can consider with the identification of cancerous cells in the histopathology slides, as well as predicting patient outcomes based on cell morphology. The examples that I'm quoting here that may be useful for some of the researchers who are connected in this course. You can explore these examples further, maybe for finding out any new research topic that you can consider for your research or for your PhD works as well, because this is some of the most popularly used or widely researched areas these days, and people are looking forward for some solid solutions in these domains with the help of emerging technologies, so that the diagnosis procedures can be improved in the long run. Moving ahead with the neurology sector, that links to the understanding of brain basically. So this neurology domain mainly focuses on the treatment as well as diagnosis related to the nervous system. That may include brain, spinal cord, or peripheral nerves as well. So with deep learning and AI, it is possible to revolutionize this field by simply uncovering patterns in the complex neurological data. You might have heard that even if some of you have already gone through medical data sets related to neurology domain, you might have seen that they come with some complex patterns. They are not easy to understand for beginners. Even the experts that are in the field, they also take longer time to understand what is happening inside, what kind of disorder they can identify. So it is a long term process. But with the help of deep learning methods, if we have like trained certain kind of model on the topic, then maybe this brain imaging analysis approach we can utilize to process CT scans, MRI or fMRI scans, etc. And they can help us to detect different types of abnormalities, including strokes or tumors or maybe some neurodegenerative diseases as well. It can also assist in predictive diagnostic, because some diseases such as Alzheimer and Parkinson's, you might have seen that there are a few early signs that they provide, but manually this is very difficult to identify those signs. Even for the caregivers or for the experts, it is very difficult to identify those signs ahead of time. But maybe if we can utilize some deep learning based models to identify those symptoms ahead of time, we can save patients from discomfort at later stage. You might have seen that there are very rare treatments available for Parkinson's disease, but if the symptoms can be identified at early stage, possibly we can delay the poor effect of this disease on the patients at later stage. Maybe we can delay the entire process behind it. Also, it can be utilized for seizure detection in the long run, because like deep learning models can be utilized to analyze EEG datasets directly, so that the epileptic activities or any kind of disorders in the brain waves that we can identify ahead of time, and we can suggest a proper treatment on for the disease. Major applications in the neurology domain for deep learning includes diagnosis of brain injuries and disorders, one of the most important consideration we can take. Like in some accidental scenarios also, sometimes there is a major injury on the head of the person, and at that time we need to diagnose this issue just instantly, because otherwise this could lead to some bigger damages in the long run. So in order to do this, instead of waiting for the manual evaluations, if we can deploy AI based algorithm, this could be a great advantage. And if those AI based algorithms offer great accuracy, if they are trained well, it can help us to save a life of the people also after certain kind of accidents. Similarly, it can help us to monitor brain activities during surgeries, so that if there is any kind of anomaly or any unwanted up and down in the brain activity, so accordingly doctors can make decisions. And of course, it can assist further in improving the research for understanding cognitive and behavioral aspects of the patients in the neuroscience domain. Some common examples that people have already implemented in their research include this detection of Alzheimer's disease with the help of handwriting analysis and speech analysis. You can see this is a kind of multimodality application that several researchers have already done, and they are getting very good results with this also. Similarly, it is also possible to predict stroke risks with the help of patient data. So that could be further one important outcome of the deep learning involvement in the neurology domain. Moving forward with another important concern in the cardiology domain, because if we even try to look in the news these days or the latest research outcomes from the medical domain, cardiology based disease cases are rising every day, and in India this has become one of the most threatening disease these days, and majority of people are losing their lives just because of cardiology. This is one of the most common factor behind death count or the mortality or morbidity rates in India these days. So there are huge requirements to have some proactive detection and prevention measures for this kind of domain. And in cardiology domain, if we involve AI principles or deep learning based algorithms, it could assist in early detection, like by analyzing ECGs or CT angiographies, etc., or heart failure, etc. It can do a early detection for all those conditions. It can also assist in risk prediction, like it can predict heart attacks, strokes, etc., by understanding the historical trends of the people. So early alarms or early notifications maybe can be generated based on the cardiac rhythm of the patient, and it could help us to save their life in the timely manner. It can also offer some personalized recommendations based on the risk assessment used by the deep learning model. Maybe the diet planning, maybe the medicine routines, everything we can use with the help of this personalized treatment. And it is likely to improve the overall quality of life for the patients that are suffering from cardiovascular disease conditions. Some applications that we can consider in this area include ECG analysis for arrhythmia detection, similarly predicting heart disease risk using patient records. And some researchers have already conducted these kind of studies, and they have achieved even up to 98% accuracy to detect irregular heart rhythms. And this could be further utilized in identifying chances of heart attack, or if the person will recover. All those things we can monitor with based on these AI algorithm based predictions. Deep learning can be also used in the genomics domain. The genomics in healthcare industry is mainly concerned about the DNA of individual person, where we try to understand the genetic variations that may influence disease conditions or health conditions in the long run. And with the help of deep learning, it is possible to design some personalized medicines that can be tailored based on unique genetic profiles of the individuals, because we know that these genetic profiles are unique for everyone. So there is not a possibility of getting a common treatment for everyone. But yes, if these deep learning models are trained well on majority of data obtained from the patients, then possibly in future we can provide better recommendations and better personalized treatments to the patients. Some roles that AI can play in this domain include analyzing vast amount of genomic data set that can help us to identify mutations linked to diseases. Similarly, it can help us to predict patient specific responses, maybe to minimize adverse effects or drug effects on the people. And it can also support gene editing and therapy development for specific interventions or based on the genetic profiles of the patients. The popular applications that you can consider for the research purpose here include identifying mutations in the genetic sequences. This could be one popular application you can consider for the research. Similarly, analyzing DNA or RNA samples for rare genetic disorders, and then cancer genomics for the targeted therapies you can consider, or pharmacogenomics, optimizing drug and prescriptions also you can consider. And similarly, it is possible to do rare disease diagnosis with the help of genetic sequencing. So these kind of techniques are being uh, researched by the experts across the world these days, and if you are working on some research case studies, you can also consider any of these applications to add more uh, fruitful results into the healthcare industry. We can also utilize deep learning in the predictive healthcare as well. This helps you to analyze diverse amount of healthcare data to identify diseases before the actual symptoms start appearing in the patients. And the main help that AI can provide us in this area is to integrate clinical, genetic, as well as lifestyle data together for better risk assessment. Otherwise, majority of time what happens if we are doing like manual intervention, sometimes doctors rely only on the clinical data. If in very rare cases they go ahead with the genetic data, and further the lifestyle data is very rarely monitored. There are very different practices that are followed by different types of doctors and in different hospitals, so there is not a like a standard treatment procedure followed everywhere. So if we can integrate all these three types of important data sets together for patient data evaluation, then probably we can do better risk assessment in the long run. And these AI based algorithms can help us to forecast disease progression as well, so that if any change in the treatment is required or if any complications are expected in coming days, we can have a proper solution for that ahead of time. And this can also enable preventive care treatments with the personalized treatment plans depending upon how the patient is recovering, how their genomics are behaving, or what kind of treatment is better suited based on their lifestyle. So this can ultimately improve the overall patient outcomes in the long run, and of course offer better options for the caregivers as well to deal with the patients. Some major applications we can consider in this, that we can also think about in the research domain, is like predicting disease outbreaks. That could be some flu or some um, pandemic conditions that we have already gone through. So if we can predict them in advance by using AI based techniques, that could be a great help. Similarly, risk assessment for chronic conditions like diabetes, etc., or severity of any disease, if we can predict, that could be also a great advantage of deep learning models. We can also utilize deep learning with telemedicine domain in healthcare industry. Telemedicine, if you have heard about, like at present, remote work is a popularly used concept. For the office, the remote work is being widely used. But in the healthcare industry, just imagine if it is possible to treat patients remotely, and that too with higher accuracy. That is possible with the telemedicine domain. This is one very popular area these days in the healthcare industry, because at present people are more concerned about getting facilities with the remote connection with the doctors, and they are looking forward for quick diagnosis, monitoring, or personalized care even from the distance. So in these all scenarios, deep learning models can be a great help, because with this AI based telemedicine remote care, we can help to automate symptom checking, as well as we can take help from chatbots to interact with the patients to gather details about their lifestyle, or if the medicines are working well on them, or if we need to change anything from their routine life. So all that thing we can equipped with the chatbot, and doctors can get relevant data time to time to make decisions about patient care even when they are sitting at remote position. It can also assist in remote monitoring of vital signs by using some wearable sensors. Many of the youngsters these days are using wearable sensors in the form of Fitbands or smartwatches. So majority of them are using it just for the daily fitness tracking, like they go for walk, they go for gym, etc., and they just do it for their regular tracking. But just imagine how good these devices could be for tracking vital signs among patients, because they can provide quick information about the pulse rates, the heart rates, or the bodily conditions of a patient, and then the doctors can make timely decisions. So if any change in the treatment plan is required, that can be opted ahead of time. Further, AI driven image or data analysis also we can help have from deep learning model, and this can assist in virtual diagnostic with these. The main benefit of this telemedicine we can consider is it can improve the healthcare access to the people who are at remote positions, who do not have easy access to uh, good quality doctors or maybe hospitals around. And it can also reduce the cost for the treatment as well, because we can handle things remotely, and of course the timely interventions for the patient condition, so that the treatments and any kind of diagnosis can be done on time. The applications that you can consider for the research purpose include real-time symptom analysis using virtual consultations. So in this case, you can consider maybe like using some NLP models, etc., some deep learning models or some LLM models, etc., that can help you to process natural language from the human beings to make decisions further. And it can also have some chatbot kind of things you can design, so that you can track everything about patients, maybe by using some mobile apps or some web apps, and that can help you make decision. It is possible to detect skin lesions also with the help of some smartphone based images. This is one example that is being used in several countries these days. They have improved their telemedicine with the help of some tiny devices that can be placed on the body for getting quick images on the license, and based on that, some quick decisions can be made on the treatment. So, this can assist in remote treatment easily. Then we can use deep learning for drug discovery and development as well. In drug discovery and development area, we need to identify some therapeutic compounds, or we need to refine them for better medications, so that as the diseases are evolving with time, based on what kind of eating habits people are developing, the lifestyle of people is changing with time. So accordingly, the disease patterns are also changing, and to deal with those changes in the healthcare industry, we need to be equipped with some modern solutions, and AI can assist in that. It can help us to identify potential drug candidates with the help of molecular level modeling. And it can even simulate drug target interactions to ensure that the suggested drugs for certain treatment have safety as well as efficacy on the end users. And it can definitely help us to develop new drugs ahead of time. We can bring them to the market before any kind of outbreak, and we can definitely save lives in the long run with this. Some applications or research areas you can consider, like predicting drug interactions and toxicity levels. You can find some data sets regarding this from the hospitals, and then you can start your research on the area. And then we can also talk about generating new drug candidates with the help of GAN models. This could be also another area. So some researchers have already designed some AI based models where they are trying to reduce drug discovery time by 50%, which is definitely a great achievement they have made. And the upcoming researchers can do it further, and they can help you get drugs on especially the life saving drugs on time for the patients, especially at the time of some outbreaks. Deep learning algorithms can also cover the area of mental health diagnosis, which is the much concerned area in the healthcare industry these days. Considering the lifestyle changes of the people around the world, people are getting like more involved in their uh, career or their work profiles instead of sparing more time for their personal health. And in this scenario, mental health traumas are also becoming more popular. So in order to deal with these changes in the psychological conditions of the people with the increased burden on their day-to-day life, it is important to find some adequate diagnostic procedures that can help us to observe the patterns from the cognitive, behavioral, as well as emotional senses of a patient or the target human being. And AI based algorithms can help us to analyze these complex patterns from the human beings, and even the non-linear data sets these deep learning models can handle well for early detection of any kind of mental health symptom. There are plenty of areas that we can cover in this domain. That includes sentiment analysis that we can do basically on evaluation of different kind of text or comment or maybe speech, etc., by just understanding the psychological state or emotional tones of the individuals. Several researchers are already deploying this kind of models on the social media platforms, and they are just trying to track how people are feeling in different scenarios, and what is the impact of even social media platforms on the personal well-being or mental health of the people, because this is one of the biggest concern these days for the doctors as well as for the governments across the world. Preserving mental health or the level of peace among the citizens of the countries, that is a big challenge for the countries these days. Similarly, the behavioral monitoring also we can do with the help of AI based models. It can help us to analyze the sleep patterns, the activity levels, as well as the digital interactions to understand if the person is suffering from any kind of distress. Because poor sleep patterns generally indicate any kind of distress for the person. And if we can track that with the help of some variables, etc., that could be a good decision making point for the doctors as well. Also, we can utilize AI for predictive analytics in this area to assess risk factors associated to PTSD or maybe anxiety or depression, etc. Some research concepts you can consider is like sentiment analysis from speech or text, and then detecting depression through facial expressions as well. And it can help you to achieve like 80% accuracy in identifying depressive symptoms. And some researchers have already achieved this type of accuracy. You can think about further improving this outcome. And over the years, several researchers are even developing new models to deal with these scenarios. Federated learning is another popular area that people are considering these days, and this is mainly to assure privacy in the healthcare sector. So, federated learning is a basically privacy preserving AI approach, and it helps you to train your deep learning or machine learning models on some decentralized data so that the sensitive information can be always hidden, and we can make decisions without tampering the personal information of the patient, which is generally a big threat in the healthcare industry. And this is the main reason why you do not get data set easily from the hospitals, because the patient privacy threats are always associated. So federated learning is offering new possibilities in this domain these days. It can help you to keep data on the local devices so that the privacy can be ensured on their terminal itself. And there is a possibility to integrate different models in such a manner that they can access data from the local devices without transferring raw data to any cloud platform directly. And they can even help you to manage with the compliance that is set by different hospitals or different countries on the patient data. So it can help you to follow those regulations with ease. And with this, we can design some AI based models without hampering privacy of doctors as well as patients, while offering better outcomes in the healthcare sector. Some applications in this area again you can consider is like AI development across hospitals without sharing patient records. It can also help you to train predictive models for wearables like smartwatches, etc., or any other kind of fitbands. If you are wearing, from there itself it can help you to train models. And then it can also assist in enhancing diagnostic AI by utilizing secure data integration from different platforms. Like you can gather patient data from multiple hospitals as well without damaging the security levels or without hampering their privacy concerns. So these are some of the most popular applications I have considered. Few of them wearables also we will include within the remote access that it provides to us. And these case studies I'll not include right now because I'll just show you one example of demonstration in the coming session also with Python based implementation. Just some challenges that we need to keep in mind while working on this includes data scarcity, because deep learning models require very high end data set available in your healthcare domain. And we need to assure that the patient information is also managed well. Similarly, data imbalance is another concern that we need to talk about, especially in case of rare diseases where it is not possible to get enough data from the patients. And data quality also we need to maintain for better outcomes in the long run. Similarly, regulatory and deployment challenges as well we have. So for this, we need to find some appropriate procedures for the clinical trials that we need to find in this area. And some other solutions that we can consider is like explainable AI. This can be one amazing solution in the healthcare domain that can offer better traction of the patient data, and we can suggest better solution that can be trustworthy for the patients as well as for the doctors in the long run. So I'll just conclude this session right here. And in the coming session, we'll talk about some practical implementation